Hello everyone, welcome back to my new video. So a lot of you asked me about the licensing exam pattern in Serbia and is it in English language or Serbian language. So today I have a very special guest, Dr. Mirshat, who recently passed the Serbian licensing exam. Hello Dr. Mirshat.
Hello, how are you?
I'm good. So in this video, he will share his experience and honest review about the Serbian licensing exam.
Hello, my name is Dr. Meshat. I'm graduated medical student from Faculty of the Kragujevac. I just passed my medical license exam 4 months ago. I want to tell you how to apply and prepare for the license exam in the Serbia. After the graduation, you will obtain the diploma from the faculty. With the diploma of the faculty and the booklet of the hospital after the finishing of the 6 months of the internship, 3 months in the primary healthcare, plus 3 months in the hospital, and make a whole stamp of your booklet of your internship. You will have to go to the notary to make it notarized and make a photocopy of them and give it to the Ministry of Health and pay the amount of fee that is around €100. After the 1 month, you will be eligible to write the exam.
So, Dr. Mirshat, I want to know about few things. So, just tell me the exam which you wrote.
Yes.
Is it MCQ or oral? How is it like in?
It's completely oral questions.
Okay. So they ask you in English language or in Serbian language?
It's up to you. Usually it's Serbian, but if a student doesn't speak Serbian very well, so the professor, as they are doctors, they can ask you in English and you can respond in English too.
So you gave your exam in English language, right?
Yes, I prefer to speak in English language.
As well as you know Serbian also.
Yes, I know Serbian completely, but I prefer, I'm more comfortable to speak English. Yes.
Okay. So if some students like if professors know they know about English language and they can talk in English language, so student can give their exam in English language, right?
Yes, of course.
Okay. So can you please tell me like how was the exam for you? It's easy, difficult, or moderate?
It's up to the students. It's usually general question. There is not like detailed or a very hard question. It will come if the students study very well during the 6 years. Yes, of course, they can answer the question properly.
So which subject they used to ask more questions like medicine, surgery, or clinical or non-clinical subject?
There is no specific subject we can tell they will ask in the exams, but it's usually belongs to the diagnoses and also diseases.
Diseases,
Yes.
okay, like hypertension,
Exactly,
diabetes, or
diabetes,
kind of leukemia, pancreatitis,
exactly like
appendicitis,
this.
like this. Okay, so and also you should learn some Serbian law. Like in India, we have some kind of community medicine questions, and so like this also you have to know some law of
Yes,
Serbia.
if I'm not wrong, there is 4 or 5 questions that from one of or two of these questions they will come from the Serbian laws in the health system. Yes, they should know it.
So they used to provide the some booklet. So this is enough for that.
Yes, it's completely enough. The exact question will come exactly from the booklet of the internship. Yes.
Okay, so did they ask you any unexpected questions or like which can bother the student or something like that?
No, whether not for me and neither for the other students, which they were with me in the exam period. All the exam question came from the booklet of the internships. Yes.
Internship, yeah, it's good. So like you completed your medicine from Serbia, especially in Kragujevac. So what do you think the quality of education in Kragujevac is good, or like how is it like it help you to do internship here, or what about your licensing exam? It help a lot, or like we all are from Ukraine.
Yes.
So how you think like Ukraine is much better or Serbia, or how you feel like
I
overall?
think Serbia much far from than Ukraine from the educations and the quality of the universities. Besides, that, it has a very good ranking in the worldwide. The Serbia, I think, education, especially in the medicine, my fields, it's very good. And after obtaining the medical license exam and everything, you will be eligible in most other countries, especially in the Schengen area and European countries, to work properly without any equivalation or maybe recognition of your documents. So it's much better.
Okay, so can you please tell me about the exam fees which student have to pay before the exam, like the fees of the exam?
It's indicated by the Ministry of Health, but as I know, it will not exceed more than 100 euros. So it's usually between 80 to 100 euro.
Mhm, mhm. So, like, if student will apply the exam licensing exam today or maybe in January, so
Yes.
student will get to write the exam on next month.
Yes, you should know that the medical exam in the Serbia is every 15 to 16 of the every month.
Mm.
So if you will pay in the 14 or 13 of the month, you will not be eligible to write on the 15 of that month. So it will be postponed for the 1 month later.
So, how is your overall experience
About what?
about exam, about like clinical exposure in our university?
Every training during the internship or whether in the 6 years of the education in Serbia, it was completely good, and for me it was enough. And during the internship also I learned a lot. I practiced in the hospital and primary healthcare, and the exam was also easy, didn't bother me so much, so I was completely satisfied with everything here in
Mhm.
Serbia.
So, what you will do in future? Like, how, like, after completing the examination, after completing the licensing exam, what is the next step for students, those who want to work in Serbia?
Personally, for me, I got the destination for my future specialization in the Serbia, so I'm planning to prepare to get some practice in the area of the specialization which I want to apply.
Mm.
So after the finishing the practice, I want to apply for the specialization in the Serbia and complete it here.
So, do you know about like what is the salary of newly doctors? What is the salary for like doctors, like for foreign student?
Like a GP, medical
Yes,
practitioner,
yes, yes,
yes.
yes.
It depends, but if they will work officially in any hospitals in the Serbia, it's usually start from 1,200 to 1,700 euro per month.
So it's like 1,30,000 Indian rupees.
Yes, should be.
Okay, okay. Thank you so much,
You're
Doctor.
welcome.